Well, the need is now, and members of the United States Air Force's Volunteer Auxiliary, the Civil Air Patrol, are providing the solution. CAP members are flying for Operation Warp Speed.
That's right. That's the name of the project to create and deliver COVID-19 vaccines across the country. The scientists created it, the companies made it, and now the problem is how to get it to the people who need it. It has some particular handling instructions which make ground transportation impossible, so it's being flown. AOPA Live's Paul Harrop caught up with one of the CAP flight crews involved.
Good morning, Duluth approach, cap 1206, level 7,000. We're flying as part of Operation Warp Speed.
We're in this fight of our lives, this massive operation called Operation Warp Speed.
And that's exactly what vaccine distribution requires. The precious cargo in specialized medical-grade coolers that take 24 hours to condition because it has to be kept very cold.
There are times where the traditional logistics chains just don't work. You've got this cold chain challenge with some of the vaccines that need to be delivered in a very specific time frame. Sometimes the distances are just too long to be able to do it, say, with a truck or simply using normal shipping methods. And so being able to access over 5,000 airports and be able to get vaccine directly to where it's needed really is what kicked off this mission.
1206 Minneapolis, good morning.
In a CAP AirVan 8, Lieutenant Colonel Robert Bowden and Major Rod Rakic bringing Indian Health Service pharmacists and the much-needed vials to far-flung regions of the north.
The Civil Air Patrol, specifically with the vaccine, at last count had moved over 9,000 vials of vaccine all over the country. And that's via ground, airplanes. We're the first to really do it in the plane on this scale. A lot of it's been moved through our ground transportation fleet. But we've been doing things such as transporting PPE and test kits by air for months.
But now, with the cargo being even more critical, care had to be taken to allow the medical officers on board to keep a close eye on it.
So you want to see the monitor.
And then they were monitored. They actually had temperature monitors built into the sides where the challenge of loading the vaccine on board so that the monitors would be able to be visible to the passengers in the back. They would be logging the temperature of the cargo over time as we flew.
The 100 pounds of prevention could literally mean life versus death. But this mission is just another day for volunteers Bowden and Rakic.
Power set.
They came up through the CAP's cadet program and have both stayed involved, serving as part of the total force of the USAF.
So at minimum, we helped over 500 people in this single flight. And these are areas that are very rural, they're remote. So being able to travel to that area, see people that are literally my neighbors up there, get this much needed medicine is really important and really an honor to be able to do so.
We really are a force multiplier for the Air Force. We want to serve our communities, our states, our nation, and we've got this resource, over 500 aircraft. We train for this, and this felt a lot like the mission that we've trained for 80 years.
Paul Harrop, AOPA Live.
One of the biggest challenges the crew faced was the go-no-go decision. With the temperature requirements of the vaccine, simply landing short of the destination and waiting it out would not work. The crews say that, hey, they had an entire team behind them to help with the challenges.